Of typhoid fever in Gauteng, and one person has since died. 4 people were initially affected. Gauteng Health has just released a statement announcing the activation of an outbreak response team to manage and trace the source of the outbreak. Typhoid is spread through eating or drinking food or water infected with human waste from an infected person. Gauteng Health MEC Qedani Mahlangu, that is visiting some of the patients at this hour. And let's immediately cross to our reporter, Lopang Alamu. She is with the Gauteng MEC. Lopang, good afternoon. Do we know exactly whether this outbreak has been confirmed and detected, where it started from?
Thank you, Obriel. Yes, it has been confirmed that the outbreak has already started. 4 of the main regions are Yeoville, Hillbrow, Palm Springs, and also in Edenvale, where we are at right now. There are 4 victims who have been reported, but 2 are admitted. Children aged 11 and 3 years of age. While they are being stabilized, but to tell me more on that is Ms. Qedani Mahlangu, the Gauteng MEC for Health. MEC, could you please tell us what exactly, in simple terms, what typhoid is?
Well, from what we understand, it's someone who's ill, and typhoid, I'm told it is very deadly and it is infectious. Someone when they have symptoms of fever, vomiting, and they've got the problems with their abdominal, so they must see the doctor. And the patients you're referring to have had those kind of symptoms, and they've been seen in our hospital. The babies you're referring to who are admitted in this hospital, when they were admitted, they were not, one of them had gastro, which he had a running tummy, and the child was being treated for that. Only after the doctor saw that there was no improvement, they started treating since last week Friday, the Friday past, treating the child with for typhoid. Whilst they took samples to the laboratory, only those samples did confirm that indeed the child has a typhoid.
Now, how dangerous is this outbreak? What can you expect from this? Because we know that there's been one fatal account of the outbreak already. You know, the 27-year-old woman who lost her life at Charlotte Maxeke. What measures have been put into place to ensure that the spreading is contained and that not a lot of people are affected by it?
I mean, firstly, the fact that we're talking to the media is just to make people aware and to inform the public that we've had these developments in our province, and it's an important one to make people aware. Secondly, we've got an outbreak response team, which some of the members are here, who go to not only come to hospital to talk to the family and all of that, but they also go to the places where these family members live, to trace family members and to look at symptoms, but also to go to the neighbors and also talk to them. We've also been in a position, one of the patients who's at Charlotte established that she works in one of the factories, and also further work is going to be done somewhere in Hillbrow tomorrow, just to do further work in those things. So we do everything we can to trace the patients whoever they've been in contact with, and that is very important. That's why we know the locations where these people are coming from. The second important thing which I want to emphasize is I'm told the most important intervention of what we must all do is to wash your hands when you come out of the toilet. And we've seen instances in public toilet when someone come out of the toilet and they're washing their hands. Please wash your hands, and at all times wash the vegetables or the food you're about to cook very, very thoroughly, including you before you touch the food. To wash your hands very thoroughly, and it's very, very important. So we must just be focused on prevention and education, and make sure that these patients who I'm told are being stabilized, the baby who had the gastro, now it has stopped. The patient, the Charlotte, is doing well. One of the 11-year-old has already been discharged. So I think the intervention we've made are bearing results.
So, MEC, what are the symptoms that people need to look at? What is it that they need to see and quickly rush off to a clinic nearby?
Firstly, we've said anyone who experiences signs of fever, vomiting, and all of that should go to the nearest health facility, any health facility, a clinic, and if they think that you must be referred to the next level of care, they will do so, as it is a case with some of the patients who have started at Hillbrow Clinic and referred to the Hillbrow Community Healthcare Center and then referred to Charlotte, and that is very important. And then I think what is also important is that when the doctors say to go home and take the treatment, but if the signs are not, the symptoms are not improving, please come back as soon as we can, and that is very important. For instance, one of the patient in Charlotte who's admitted currently was the blood tests were done, and she then, the mother, or she asked for a day pass to go and see the mother, and after the hospital received the results, she was immediately instructed to come back to the hospital so that they can start the treatment and all of that. So it's very, very important that we all work together, and family members, people should not be alarmed. We can deal with the situation. Just let's adhere to infection control measures and the basic hygienes that of washing our hands, washing the food, and wash your hands before you prepare the food.
So how important is it for the nation to know that it will not spread as quickly as you promised that it won't?
Well, the teams that are existing in Gauteng, they are well experienced enough to trace all of the patients, and we have activated our mechanism such that we are monitoring every hospital that they must give us information on a daily basis. So I don't think we are going to find a case which we're not going to detect. And we've said to doctors, as a patient present themselves to the hospital, besides testing for malaria, also test for typhoid immediately. And again, this is also preventing that we test for this much earlier, and we can pick it up earlier, because if you do pick it up earlier, it's not going to spread, and you can treat the patients. Hence, one of them has been discharged already. He's gone home and with the treatment that they must adhere to.
All right. Thank you so much. That was the MEC, Ms. Qedani Mahlangu, who explained that the outbreak is not as serious as people would like it to be, but she also explained that there's been one victim who's already been discharged, and also that the ones who are admitted here at Edenvale Hospital are stabilized. So the condition is well, it's managed well, it's handled well by the Department of Health, and she has also urged members of the public to be cautious when they have their food, to wash their vegetables, to wash their fruits, to make sure that they wash their hands after using the toilet, after touching anything that is within the public facilities. That is Lopang Alamu crossing live from Edenvale. Thank you very much.
Well, many thanks there to our reporter Lopang Alamu, coming to us live from Edenvale in Gauteng province.